We followed data from the Health Surveys for England and Scotland. We took about 80,000 adults between 30 and 95, and we looked to see how their participation in particular sports would prevent perhaps premature mortality or their likelihood of dying at approximately about 10 years later. So the research was cross-sectional at the beginning, and we followed longitudinally and looked at the health, some of the death data held at health services level. And we calculated based on the 6 most popular sports all lined up here. We had cycling, we had football and rugby, we had swimming, racket sports, running, and if you can imagine, aerobics and kind of gym-based work as well. And those are the 6 most popular sports that adults reported doing. And what we did is we looked at adjusted and unadjusted models to see how much reduction in all-cause mortality and in cardiovascular disease mortality we got for performing these particular sports alone compared to people who didn't perform those sports. First of all, we looked at the risks, the reductions in terms of risk of death, all-cause mortality for the different 6 sports. And what we found was significant reductions for cycling, aerobics, swimming, and racket sports. Racket sports, in fact, turned out to have the biggest reduction in all-cause mortality. And in cardiovascular-related death, we saw only aerobics, swimming, and racket sports had an effect. Now, of course, this misses out probably some of the most popular sports that people play, which is football and rugby, and running. And we were really quite surprised by that result. We suspect it's because of the age profile of people who perform those activities. You've got to be fairly young in order to engage in team sports, and what we notice is that the drop-off in those team sports happens mid-30s and latest 40 years old. So we think the cohort had a much younger running and team sport profile, and what of course we don't have is sufficient numbers of deaths in those younger group, because they just haven't happened yet. So perhaps in 5 or 10 years' time we will see a change, and all these activities will be protected for health. We've got indications from trials. We know if you take doses of running and football and rugby, everything will change that's important, your physiology, your mental health benefits, and your social benefits. So for us, the key message of this is keep doing whatever you're doing, particularly if it comes to sport. You don't have to take it seriously, you just have to do it regularly. And if you stop doing it, replace it with something else. And our obvious suggestions from our other work we've done in the department is it's got to be walking, because that's the best thing that most people can access. So whatever you do, keep doing it regularly, find something you love and do it with people you love, because you'll keep doing it.